And now we welcome Assemblyman Jay Weber from the 26th District, Republican. Thank you so much for being here. Meet the leaders. Appreciate it. Nice to see you again.
Good to see you.
We've been hearing a lot about health care concerns in the state of New Jersey. Anything being done on that front?
Well, one of my primary focuses in the Assembly this year will be to make health insurance more affordable for all New Jerseyans. I'll be introducing legislation this spring that allows people to buy health insurance from outside of the state, free of many of the mandates and regulations that New Jersey places on its health insurance policies, and that should make instantly health insurance more affordable for every New Jerseyan.
So right now, people from New Jersey have to buy health insurance from some place in New Jersey.
Companies that are licensed to issue these policies in New Jersey. The problem is that the licensing requirements in New Jersey are so onerous, and we're so hyper-regulated in New Jersey that the same policy that's available here could be as much as 40% or 60% less just across the river in Pennsylvania. And that's one of the reasons why I think we see so many uninsured individuals in New Jersey. My proposal would be to allow insurers to come from out of the state, get certified to sell their policies here in New Jersey, but free them from all the hyper-regulation and over-regulation that we see, and then lower costs immediately for consumers here in New Jersey. It's a zero cost to the taxpayers of New Jersey. It lets the free market operate, and it attacks, I think, one of the highest priorities we have in the state, and that is expanding health care coverage to all New Jersey citizens.
Why do we see such a difference in price? Like you said, up to 60% less by getting it from out of state.
Well, we have several regulations in New Jersey that make health insurance more expensive here. There are as many as 31, 32 mandated coverages in New Jersey that aren't mandated in other states. Everything from very obscure diseases to some diseases that, for example, breast reconstruction after breast cancer. Those are laudable procedures to cover, but when every man in New Jersey has to get the same coverage as every woman in New Jersey, it just doesn't make any sense. And so other states are delivering health care better to their citizens. They do it by allowing the free market to work and allowing insurance companies to pick and choose what coverages and what procedures they want to provide to their insureds. And if we can allow that competition to flourish here in New Jersey, we will instantly, like I said, lower premiums for people who buy in the individual market as well as small employers in the state who will tell you that along with all the other regulations and taxes in New Jersey, the rising cost of health care are choking our small businesses. And if we can allow them to go out of state to insurers who don't have to abide by all of the regulations and all of the mandated coverages that we put on them here in New Jersey, small employers will instantly be able to provide additional coverage, or sometimes for the first time coverage for their employees.
Right, we're seeing some small businesses cannot even afford to offer health care, obviously, to their workers. So this may be a way for them to offer it because they'll be able to afford it then?
Absolutely. I mean, you know, family coverage for a small employer could run as much as $14,000 to $15,000 a year for one employee. That's simply not doable for many of New Jersey's small employers. But under this program that I would propose, and I will advocate vigorously here in the Assembly, small employers could purchase those same policies for as little as $6,000 to $7,000, be able to bring their employees and their families under the coverage, and then save the New Jersey taxpayer from having to subsidize other health coverage for the people who currently don't have insurance.
And what has the response been from other legislators when you've talked about this?
Well, we're just introducing the bill this spring, so I hope the response will be positive. Look forward to working with members of either political party who are really interested in lowering health care costs immediately. It doesn't have to be a Republican proposal, it could be a Democrat. I would reach out to my colleagues on the other side of the aisle and hope that they'll join us on this initiative.
And what are your views on the Family Medical Leave Act that we're hearing about right now?
Well, that's going through the Assembly today as we speak, and I think it's a bad bill. It's a tax increase on our workers. It's a payroll tax. It's as much as $100 million in the first full year of the program, and that's, you know, we're taxed enough in New Jersey.
So we'll pay more out of our check into the state because of this?
Exactly. Every employee will be have an additional payroll tax placed on them. The governor last month said that he was going to balance this budget without raising taxes, and now we get in the next month we have a $100 million tax increase. In past years, the legislature has raided the Disability Insurance Fund, of which this will be a small part, to help balance the budget. There's no guarantee that they won't do that again with this tax increase. And it's going to disrupt operations for many small employers across the state. There's very sympathetic goals behind the legislation. I just think that it's poor public policy, and that too often we pit employees against employers in our state. What's really best in this case is for the state to step out of it, let small businesses and their employees work out the crises in their lives, and in that way we can have public policy by leaving them alone that is best for workers and employees, workers and their employers.
Yeah, right now on the federal level, you can take off for a family medical leave, but it's not paid for. Is that correct?
Unpaid.
It's unpaid.
And of course, employers who have 50 or fewer employees are not covered by the statute, so that your small businesses aren't encumbered by all of these regulations and disruptions to their operations that this bill will provide, because no small employer in the state is exempted. Every employer in the state, regardless of how many employees they have, will be subject to it. And of course, if you have 3 employees and one of them needs to take this paid leave, the employer will have very little choice but to let them take it. And of course, if you miss 1/3 of your workforce, that's going to be a substantial disruption to your business.
It could make a difference. We only have a couple minutes left. Under the governor's proposed budget plan, he has mentioned a cut to the smaller towns across our state. Will that affect your district? And are you concerned about that? I'm
concerned about it for the whole state. I have some small towns in my district. I live in a town that has fewer than 10,000 individuals, and the governor has proposed to radically slash municipal aid to smaller towns. We need to encourage shared services, even consolidation where it makes sense. But the governor seems to be looking at small towns in New Jersey as part of the problem. I think he needs to turn his attention to some of the other larger cities who waste millions of dollars each year in taxpayer dollars before he goes looking to force consolidation down the throats of small towns who are operating quite efficiently, from best I can tell. And if they want to consolidate, they can do that over a period of years. But to expect that they will adjust on the fly and in the next 3 months begin to consolidate, merge, or share their services is simply not feasible.
Have you been hearing a positive response about shared services?
Absolutely. I think all our municipal officials are looking to save taxpayers' dollars and cut property taxes and get under the caps that they have to get under. And we want to encourage them to do that. Governor's plan kind of goes after it rather broadly and I think awkwardly. And make no mistake, we applaud the governor for wanting to try to cut spending. We wish he would cut it more. The governor's budgets have gone up 20% over the last 2 years. We think he can cut spending even more, but the first place he should look is not to this small town New Jersey where property taxpayers will bear a disproportionate burden. Okay, well, thank you so much, Assemblyman Weber, for being here on Meet the Leaders. It's been a pleasure having you again. Thanks. Best of luck with all the decisions that you have to make. I appreciate it. And with helping us. Thank you so much. Thank you. And we'll be right back with more of Meet the Leaders. Please stay with us.